so impatient right now. Hey guys, sorry we're a second or two late getting in. We're fighting with the tech gremlins. We've been trying to get this damn PDF that the White House got put out to work on my system. It decided to corrupt the PDF when I downloaded it, and
hold on, I'm trying
doesn't
to
want to
send
open it
stuff
now.
to Allie.
Yeah, Jen is trying to figure out a way to just send me the PDF.
am fucking.
You know what you could do if you were able to download it, put it on your Google Drive and send me a Google Drive link. Let's see if that works.
Wait, what? Do what?
Okay, go to your Google Drive and try uploading it to your Google Drive and see if you can send me a link from there, and that might work.
Let me send you the
for
file
some
from there.
reason,
Hold on, I'll do that. Duh. Why did I not think of that?
No, I did not. Thank you, Ikeda, for letting me know to let everybody know that. Because I've actually had this problem before once or twice where a PDF decided it didn't feel like frickin' working when I downloaded it off of Firefox and Chrome, but like I downloaded it on my phone and then put it onto Google Drive, and downloading it from Google Drive, it didn't corrupt. I don't know why it's doing that. There seems to be some kind of thing going on. But let me put that announcement out on the thing. So sorry that we're a little disorganized tonight, but like it looked like it worked fine, and then it was just like this PDF is corrupted.
I'm fucking over everything right now. Like
Oh, thank you so much for your super chat, Ikeda. You know I had to be the first in line to buy a ticket on the train. Quick explanation for that. Channel memberships. This is the very first Zania Coalition where they're available. I just got them set up. Here's the problem. YouTube is kind of dumb, and that is they are requiring that I get a certain number of members before I can like actually upload all of the emotes that I picked up for the Discord server, which anybody who's in my Discord server can use them in the Discord server for free, obviously, but in YouTube, they only let you have custom emotes if you have channel memberships, and it looks like they seem to like gradually be scaling up how many members you have to get access to each emote. So the whole boob train is not available currently, even though there's a full boob train that is available in the Bridge server. The boob train, we need at least 4 more members. Thank you so much, Witch. 3 more members now before we can
Allie,
get the caboose.
real quick, can you send me your email address again?
Oh my God, Jen. So while I'm sending you my email, do you want to talk a little bit about why we picked tonight's topic? Because this is actually a pretty big deal.
Because Republicans. I think that's because Republicans. Because Republicans are just so angry and they're so afraid of the vaccine.
Ikeda, by the way, I didn't see a color in your set, so we're going to start with pink, white, and blue from Melida. Thank you so much for your super chat.
The Republicans don't want us to get paid and be healthy. That's why.
No, they do not. They are very unhappy with the concept that we could get paid and be healthy. So we are trying to get the actual White House release of the COVID-19 response plan.
Just sent it over to you. Should we remind them about super chats?
Yeah, as always, super chats. If you spend $5 or more for a super chat, we have, I believe you said do you want to do an hour and a half tonight? Like, do you want to just see where it goes? We always have at least 10 slots open. You get to change the 3 lights that Jen has to 3 different colors of your choice. Jen will let you know if you're too specific with a color, but most general primary colors we have access to. And that will stay that way for 5 minutes. So,
okay, so
Variant, you did not actually send your text. Fire colors, please. So red, orange, and yellow.
Yes, and I'm not gonna pronounce that name. Pink, white, and blue. Okay, hold on.
Melida.
We're under that snowstorm in the country, and
Variant says red, orange, and yellow. So we have. We also have 2 from Ikeda, but we didn't get colors either time. So
Ikeda said pick colors. I get to pick.
Oh, you get to pick for both of them? All right, sweet. So we've got 6 more at the minimum left. So yeah, remember that we do this every single week. So do not feel any sort of fear of missing out pressure. We do this every week. So if you don't get in this week, you'll get a chance to get in next week.
Yep.
But yeah.
Pink, white, blue. Okay.
Oh yeah,
Thank y'all, because this
YouTube hates
lighting is
variants
like
apparently.
shit on my skin right now, and it's showing y'all how fucked up my hair is. So thank you.
All right,
I
so let's start the lights so I
appreciate.
can start the timers.
I'm getting there. Wait, give me a minute. Figure this shit out, because now I can't freaking
What is professionalism? Also, you got it uploaded, but did you? Oh, you emailed it to me. That's what
I
happened.
emailed it. Let me see if the email's gone through yet. Yes.
I do know, though, that Biden, after dragging his goddamn feet, and yeah, I'm going to drag him for this because you know what? We don't have a requirement for party unity within Democrats or the left overall. So, yeah, I'm just going to have to say that, like, after dragging his goddamn feet, he's finally talking about a halfway decent stimulus check as being part of COVID relief, even though he seemed to kind of oppose it while he was running.
Okay, yeah, I don't know what's going on, but my color selection is not here. So, you talk.
It worked from your link. It must be something going on with my browser, I guess. Something in the browser does not like these. So we do now officially have the release.
I'm going to figure out the lights. You talk.
Okay. So basically, for those of you who don't know, unless you were living under a rock, you probably knew even from other countries that Trump's COVID response was absolutely atrocious. And by that, I mean there basically
Trump didn't have a COVID response, actually. When
that was the joke.
Yeah.
But by that, I mean, he basically didn't have one. Oh, thank you so much, Jericho Spades. Thank you so much, Tara Lana. Hope you're both doing well. Pink, blue, and purple.
I've got that written down. Okay. Oh, it's because I was.
Welcome to your new membership, Jericho. As soon as the channel tells me that I'm able to put the caboose on, I will put the caboose on, and then I will ask you guys, those of you who are members, to let me know what you want as the next emote. Because all of the emotes that are in the Discord server, I know anybody who's going to be remembering is probably going to be in there. You can see them all. Let me know which one you want next. So,
why is this being a douchebag?
How many more do I need? Is it going to let me yet? Nope. It still says that I need...
Yeah, guys, like fucking nothing's working tonight.
One more member and it'll let me have a 7th emoji. So one more member and we will get the caboose on the train. So... if it's up, you got at least one of your colors. Jen is having a night. She got dumped on with snow, so apologies that this is so much less professional than it usually is. Like, I know we normally have a thing. Hey, for those of you who have access to the F-bomb emoji, you have the F-bomb emoji.
I am so fucking done, y'all. Like, this shit was cute. Like a day ago, it was adorable, right? It's like, oh, all the pretty fucking shit on the ground. This is fucking great. Look at, god damn it, now my fucking... It's like, oh, look at all this pretty white shit on the ground. And then delivery stopped. And then the roads were closed. And then the cops couldn't get to places. And then garbage pickup stopped. And then the blackout started happening. It's snowing again.
Well, Jen gets herself... Well, Jen pulls herself together for a moment. Do we count this as having finally started? Do you want me to start the...
yeah, I got it going.
Okay, sweet. You said that you're tracking who's doing what. I just got to run timers. That's good. Yeah. So, coming back to the preparedness PDF, I am going to post the actual White House link for those of you whose browsers are not broken. That way you guys can take a look at what we're looking at. This is the official White House release on the strategy that Biden is going to be employing, which heavily revolves around executive orders because currently he doesn't trust Congress to help out with a lot of this stuff. He's trying to currently use the bully pulpit to get a stimulus package pushed through in Congress so that he can get funding for a lot of these programs, but he is pushing very hard to get these. So this PDF opens up, but after rambling incoherently for a little while in lots and lots of politicians speak about how important it is, states the national strategy is organized around 7 goals. 1, restore trust with the American people. 2, mount a safe, effective, and comprehensive vaccination campaign. 3, mitigate spread through expanding masking, testing, data, treatments, healthcare workforce, and clear public health standards, which, if I recall correctly, within the last couple of days, didn't he put out an executive order requiring nationally planes, trains, buses, etc. People have to mask on them now.
Yeah, a couple weeks ago, any kind of national travel that travels between states, you have to wear a mask. So that is planes, that is trains. This doesn't apply to your personal automobile, but anything that is not your personal vehicle, anything you don't personally own, you have to wear a mask now.
Sweet. 4 or 5.
Which is kind of dumb because mass transit is not a thing in this country. So it's like
it's as close to it's as well. I mean, that's also issuing kind of White House guidance to encourage states along those lines. Like, hey, the federal government's doing this. Why won't you?
Is any fucking state listening to the White House right now? Like, let's be fucking honest here.
I mean, our state is, but we're also blue as the day is
yeah,
long.
We're fucking not.
The polls closed and they called Washington. Okay, like that. This is how blue we are. 4, immediately expand emergency relief and exercise the Defense Production Act, which, if y'all remember, we talked about how Trump absolutely should have done that back on this show. And, like, Biden's like, I'm going to actually remedy the mistakes of the past. Jen is going to pop off. Oh, my God. Jen's dying in the corner there. Like, Jen's just going to lose it. It's a night. 5, safely reopen schools, businesses, and travel while protecting workers. I don't know how safely we can do a lot of those things currently, but that's just my opinion as somebody who nearly died from the fucking thing. 6, protect those most at risk and advance equity, including across racial, ethnic, and rural/urban lines. And 7, restore U.S. leadership globally and build better preparedness for future threats.
We can't even manage to get a state to. We can't even manage to power a state, but yet we're gonna go for this. Okay. Okay. Sure. I'm not very optimistic tonight.
So they spend pages and pages and pages describing why these goals are important. So you have to skip all the way down to page 28 before we start to get to actual policy, which is pretty typical of these sorts of press releases, right? It's a lot of gabbing in order to impress people. And also the majority of people are going to get bored before they get there. Sure.
666, if a national emergency is declared, he may be able to turn around and say, well, now this is what the states have to do. But he's going to get a lot of pushback.
I mean, he will get pushback, but at the same time, with the current death rates, like, he could actually declare a state of emergency.
He could, but enforcing it would require the National Guard.
Mm-hmm. Well, and part of his plan is reimbursing states who have to use the National Guard.
Right, but what I'm saying is, I'm sorry, he can't call in the National Guard. What he would have to do is call in the Army Reserves in order to enforce this, and call in federal law enforcement in order to enforce this.
Jen is not in Texas. I don't know if she's comfortable saying what state she's in.
I am somewhere in the state of Tennessee. We've fared better than Texas. However, I have a lot of friends in Texas who are currently on day 2 of no power. They are running out of water. They are running out of food. And their homes are
rolling scheduled blackouts are a big
That's not
thing
happening
currently.
They're not happening. They're not happening. They said that they were going to do rolling schedule blackouts. Instead, just shut the power off for hours at a time. But downtown Dallas is, fully lit. Where did my bra strap go?
Yeah, well, they did actually do it in rural areas. I have a friend in rural Texas who had to go out and risk their life up on their roof to get their solar panels running because they had their power knocked out in their entire city in order to fuel, like, some of the larger towns. So they did actually do rolling blackouts. All right, next set of colors. There we go.
That is better. I think
Jen is now attempting to seduce you all. If you're an OG viewer, you will know
I'm
what
not
that means.
seducing fucking anyone. I'm trying to balance out this shitty fucking lighting and making me look half dead. That's what I'm trying to do.
All right, so when you get to page 28 in that long-ass PDF, you start to get to actual policy. So let's take a look about what goal 1
real quick,
is
Alexandra.
going to look like.
It would be helpful to get Congress's approval. However, he can, because he is the commander-in-chief, he can absolutely order the Guard without Congress's approval. You need Congress's approval to wage war somewhere. But this would not be considered waging war. This would be considered a national emergency. Also, the president can wage war, I believe, for 72 hours before consulting Congress. So, there's that.
Fuck this specific spot on the map for 72 hours.
Yeah, fuck this specific area.
Immediate actions for Goal 1. Executive order organizing and mobilizing the U.S. government to provide a unified and effective response to COVID-19 and provide United States leadership on global health and security, January 20th, 2021. So, really, really long executive order name, but on the 20th, he put out the first stage of this plan, which was this executive order. It basically created a COVID-19 national response structure at the federal level to help address the pandemic, effectively recreating the response team for pandemics overall that got dismantled by the Trump administration.
Right.
Do you want to kind of expand on that a little bit?
Greyheart Labs. We will not be addressing what is going on with the Texas blackouts tonight. However, I will be releasing a video either tomorrow or Saturday that covers what is going on with that.
Yeah, like I was just having an aside that the Texas blackouts are happening, like because I have a friend who's got firsthand experience with them and was notified by their power company that they would be happening. But people could very well potentially die from them, but that's not the focus of tonight. Tonight we're talking about a national thing.
Yeah.
So, do you want to expand a little bit about this executive order that was released on January 20th?
Which part do you want me to expand on?
So it was it established the White House COVID-19 national response structure to coordinate across the U.S. government, restoring the White House Directorate on Global Health and Security and Biodefense established by the Obama-Biden administration. So do you want to go a little bit into why that was necessary?
Needs to happen because what happened under Trump was he disbanded the pandemic response team shortly before COVID hit and removed pretty much everyone out of the White House that could deal with a pandemic. When he did slap together his team, he slapped together his cronies and didn't really have any actual experts. Now, to give you all an overview of Trump's handling of the pandemic response team, the leader was Mike Pence. Mike Pence, back when he was governor of Indiana, defunded Planned Parenthood and defunded free clinics to the point where he had to deal with the largest STD outbreak in the state of Indiana. So this is who he put in charge of public health. When the Trump administration left, this team had left also. Biden is now restructuring his own team. Back during the Obama administration, Obama had to deal with an outbreak of SARS coming out of Mexico. So what Biden is doing is modeling his pandemic response team and his overall team on the model of what did we do when SARS had broken out. Yes, 666, he removed the needle program. Mike Pence removed the needle program for HIV too. He dealt with the largest STD and HIV outbreak in the state of Indiana's history. Also, teen pregnancy skyrocketed over 200% when he did that in the state of Indiana.
Fun facts that you learned from Jen. All aboard, everybody. So, coming back.
Yeah, y'all know it's cold because the boobs are actually covered today. So,
so one of the things that he emphasizes, though, in this section 1 is building clear channels of communication with state and local leaders. This is something that the previous administration actually bungled pretty badly.
Correct. President Trump, as we later learned, did not have a vaccine plan, did not really have a pandemic plan. So what he did was, in order to hide that, he blocked channels of communication between the states and the federal government to hide the fact that there really wasn't a plan, so that nobody could call him out on it and say, well, what are we supposed to do? What he was doing with the states is he was consistently telling them, hold on, we're working on it. I still get a Jen's pick and it's still going to be right because I don't want to fuck with it right now. He was saying, don't worry about it. We have a plan. We're just going to have the federal government take this over. And by and large, left states holding the bag. It was a constant wait and see, with no active lines of communication. When the states started to push, when states like New York and New Jersey and California started to push on Trump's office and administration saying, hey, we need a plan, we need federal help, he pretty much told them, well, your state has all this money, why aren't you taking care of it?
Well, and like there, again, there's a rambling pages and pages about particularly allowing the Surgeon General and directors of the CDC to speak directly to the American public rather than filtering everything through representatives.
Right, and that also happened too. By the way, guys, can I just point out this mug? Y'all see this mug? It says, we are happy to serve you. Y'all know why I got this mug? If you ever order a cup of coffee or a cup of anything to go out of a restaurant or off a truck in New York City, you will get a paper cup. that looks exactly like this. And this is a New York staple. And I found it, I forgot what website, but just search the Greek New York City coffee cup if any of y'all want it. Yeah, Trump decided he didn't like what the CDC was saying because they weren't allowing him to downplay it. That he didn't like what the Surgeon General was saying because they weren't allowing him to downplay the severity of it. So instead of having them address the public directly, in order for him to control the source of information, they had to go through him, and then his office would determine what was released and by whom.
Yeah. And so we've actually, on the subject of transparency, we've actually got a few other executive orders under this first page section. On pages 32 and 33, it talks about getting funding available for putting together data and making that data publicly available for anybody to find naturally. This is another executive order ensuring a data-driven response to COVID-19 and future high-consequence public health threats, direct steps to enhance federal agencies' ability to collect, produce, share, analyze, and collaborate in order to support COVID-19 response and recovery. The federal government will also work to strengthen state, local, and private sector efforts to collect COVID-19 data on a range of issues that are needed to beat the virus, including case rates.
Hey, Allie, you're cutting in and out a bit.
Whoops, sorry. Let me see if moving my mic a little closer.
Not cutting out, but it's like roboticizing. Robotic.
Is that a little better?
A little bit, yeah. It's like
okay.
Thing.
If it's doing that, then it might be my net.
It could be, because Allie's dealing with shitty weather too, so we're fucking trying to get this shit to you people.
Yeah, it snowed and then it melted and now it's freezing again, and we've also had like the branches that came down when it snowed, and like we've had rolling brownouts as well in our area, so that was not fun. On a range of key issues that are needed to beat the virus, including case rates, stratified key demographics, e.g. race and ethnicity, cases by setting, e.g. LTCF, prisons and other congregate settings, hospital and ICU capacity, testing access and turnaround time, effectiveness of contact tracing and quarantine efforts, and physical distancing and masking adherence. So basically, there's an executive order demanding funding and plans being made to sort of create a much more unified federal data collection on all of these issues.
Again, this was dropping the Trump ball. A lot of this has to do with contract tracing. Contract tracing, that's the word. And Trump did not want a federal contract tracing, again, because he wanted to downplay the severity of it. So again, that was largely left up to the states. And also, the Republican view is largely, let's govern as less, federal government as less as possible, leave it up to the states. It has now been found out that Andrew Cuomo lied about their COVID-19 numbers coming out of nursing homes. And they were, in fact, a lot higher. What he was instructing the state to do was to, again, downplay the severity, which goes to show you just how fucking bad it was in New York City. To downplay the fucking severity, he turned around and told the state that if a nursing home patient dies in a hospital, we are not to record that as a nursing home death. We are to record that as a hospital death. Had there been federal oversight and had there been a federal checklist on how to report and how to contact trace, this would not have happened. This wouldn't have been allowed to happen. Okay,
so is the clipping getting better, guys? Like, does it sound any better? I might have to, let me drop really quick and see if I can fix it that way. It might be a glitch of some kind going on. So I will be right back. Jen, the section that we are on, if you've got the PDF open, we're moving down to page 37, talking about vaccinations and the executive orders that just went out to help meet the 100 million vaccines.
I want to explain a bit more of this federal. Are we on the second? Okay, hold on. Red and orange. Okay, this is going to be super easy for me to do real quick, so you guys are just going to have to fucking bear with me. I think. Let's see if the lights are going to work. Maybe not. It's working. Hold on. Red and orange. Okay. Yes, and we still have slots open for changing the light colors. Any super chat over $5. God damn it, don't shut the phone off. Any super chat over $5 will let you change 3 lights, any series of colors you want, 1, 2, 3, whatever. So, yes, Victoria, the not coordinating the federal response absolutely was a way to, again, minimize the severity of it. What Trump was hoping...
Testing, how does it sound?
Much better.
Yeah, it was a glitch then.
Yeah. What Trump was hoping to do was hoping that largely states would govern themselves and largely states would become islands, and that they would become, and this is something that he has done over the course of his career, is that he makes himself so difficult to deal with that he doesn't have to work. So he made himself so difficult to deal with, put so many roadblocks up, that he thought states were just going to kind of turn into their own island. So that when he turned around and everyone's like, well, what the fuck are you doing? He's like, but I tried and they just stopped coming to me. So it's not my fault.
Hey,
It's
Marrow.
the state's fault. Hey, Marrow. It's
Marrow
the
and I are-
state's fault.
Marrow and I are actually going to be working on a collab fairly soon to be talking about the state response to COVID-19, particularly around how people with disabilities have been being denied life-saving care and treatment.
Yeah, that was a fun night of conversation, wasn't it?
Yeah, that was so very fun. I raged out in Jen's DMs when I like found all the data on this. Like it's across multiple countries at this point.
Yeah. So that pink and purple.
All right, sweet. How many slots do we have left, by the way, Jen?
We have filled 1, 2, 3. We filled 6.
We filled 6, so we have at least 4 left. We might, when we hit the hour mark, if we're going to keep going, we might extend that and open up new slots. So, we were getting into the aggressive vaccination goal, 100 million in the first 100 days.
It's happening again. That clipping's happening again.
I have no idea what to do about that at that point.
Well, fuck it. We'll do it live.
I mean, wait, is it this sound?
No. It's like you cut out and like robot a bit. Like it sounds.
It's probably sounds my like net at that point.
It sounds like you're sucking a dick and trying to talk.
I have no idea then. It's probably my net. My net's been going off and on. I'm sorry about that. Carbuckle has taken red, apparently.
I got Carbuckles down. Thank you, Carbuckle. So, yes, you wanted to move on to the next.
So, ensure the availability of safe, effective vaccines for the American public. The national vaccination effort will be one of the greatest operational challenges America has ever faced. So, they're talking about using the Defense Production Act, which you said that you wanted to expand on, in order to manufacture vaccines rapidly to meet the demand.
Right. The Defense Production Act, I believe, was started in either World War I or World War II. It was one of the world wars. And when
the viewers are saying that it's on your end.
Maybe it's my end. Okay. So what the Defense Production Act does is the president turns around and says, we are dangerously low in X whatever fucking product, and then puts manufacturers on alert and gives them incentive to make that product.
Basically, it's like paying an extra stipend, kind of like what we do with farmers currently, actually. There are stipends that pay farmers extra not to produce milk currently because there's such an overproduction of milk that, like, the government doesn't know what to do with all of it. Thank you so much, Jericho Spades.
That aren't
red. And two of your choices
I just put not red. Like, that's all.
Red plus not red.
I just put not red. Excuse me. I believe back in World War II, I think it was nylon that the Defense Production Act was incorporated for, was nylon, because they needed it for like parachutes and shit. Mm-hmm. So what they do is they find companies who make these things and they give them monetary incentive and also pretty much tell them, we don't give a fuck what else you make. You have to make this first. And what it does is it releases manufacturer quotas, and it pumps whatever is needed into the market at a rate that is sustainable. They get monetary incentives. What they were trying to, was it the Korean War 666? I for some reason thought it was World War II. What they were trying to do with Trump with this was they were trying to get Trump to authorize this to make masks, and he never did it. They were trying to get Trump to authorize this bill to make masks, to make face shields, disinfectant sprays and disinfectant wipes and hand sanitizer, but he wouldn't do it. This pretty much says, okay, like if it came down to masks, 3M. We all know 3M is like the leading manufacturer in N95 masks. They would have given 3M a chunk of money and said, hey, this is what we need as a national emergency. Your sole fucking purpose right now is to make N95 masks.
Well, and actually another example would be paying Boeing or SpaceX to manufacture, ventilators.
Yes.
because
Yeah. Ventilators. Right.
because they have
Respirators.
they have production facilities that got put on hold during the height of the pandemic that could have
Right.
been reopened with essential
Right.
workers paid a stipend, because Boeing, for those of you who don't know, hi, my
Boeing
family is
makes
a Boeing
fucking
family.
everything.
Not
Boeing
only does
makes
Boeing make fucking
everything.
everything, but also Boeing has a bunch of buildings that are basically just empty that they have, that they pay, that they get like tax breaks on and shit, especially in my state, because, Boeing sneezes, Washington catches cold. And so at any point during the height of the pandemic, Trump actually could have utilized the Defense Production Act. In fact, Boeing's CEO was pushing him to do this so that they could mass produce, they could like have a financial incentive to utilize these factories to mass produce ventilators that could then be distributed.
Victoria, it wasn't that they were paying them to make ventilators that didn't actually work. What had happened with that was there was a stockpile of ventilators and respirators
And nobody had
that
tested
weren't
them.
tested, and had expired. That Trump said, "Oh, we have a stockpile of," and sent out.
Yeah. And he
Yeah,
only sent them out
was
to states that he liked. He didn't send them out to the states
yes.
that needed them. He
Okay,
actually
so
screwed over New York and Washington for opposing
oh,
him.
big time, big time.
Again, we're trying to focus on Biden, not Trump, but the problem is so much of this
purple.
document, it's very easy to see if you understand politispeak that a lot of this document is a gigantic middle finger to the previous administration. Like, there's a lot of very obvious stuff here that's being repeated over and over because of the mistakes of the past. Like, you can see very heavily that they are trying to be like, there's a new sheriff in town.
I'm trying to explain why he has to why Biden has to put this in, and what was lacking. So my app is being all fucked up, so I have to keep ending it every time I want to change a light. So might take a while.
So coming back to the vaccines, though, here's a really big one. And this actually, we need to talk a little bit about. Oh, thank you so much, Carbuckle. That might actually be the last member that I need really quick to add the caboose. Let me see if it'll let me now. It might. I will refresh really quick and see if it will actually let me add the caboose. So you guys might, I don't know if you'll have to refresh the stream in order to get access to it, if it's going to let me. But if it does let me, then you guys should get access in just a moment to the caboose, because that's what I'm actually trying to
I'm trying to change these lights over, but the Google Home app doesn't want to work right now. So now I'm trying to go through the C by GE app to see if that works.
Oh, there we go. Yep, it looks like I'm going to be able to add the caboose tonight. So, quick survey from members. Anybody's got the little icon next to you. What emoji would you guys like me to do next? We need 5 more members before I can do another one. And for those of you who are on my Discord server, any of the Discord emojis that I just added are open, including the burning ram stick. Because Ocean and I did a trade on that. Give me a moment. Let me pull up the emojis, and you guys should have access to the caboose momentarily. All aboard 3. All right, it should be up. I don't know if you guys will need to refresh to get access to it, but I did update it. So all members, you guys should have access to the boob train caboose now. So coming back to the response plan, though, vaccines, this is another really important one. Let's talk about standardization of vaccine rollout, because you and I were actually talking earlier about some of your gripes about how it's being handled in your state versus my counselor and a good friend of mine who works in healthcare both actually just got vaccines. Call on states to expand eligibility to frontline essential workers and individuals 65 years and older. We cannot leave supply unused or let it expire. The administration called on states to open up eligibility beyond healthcare workers and long-term facilities to include frontline essential workers like educators, first responders, grocery store employees, and anyone who is 65 and older. Adults 65 and over account for 16% of the U.S. population, but 80% of COVID-19 deaths in the U.S. As we expand eligibility to ensure that supply does not sit on shelves unused, the United States will continue to look to the CDC Advisory Committee on Immunization Practices, ACIP, framework for an equitable, effective vaccination program and work hand in hand with jurisdictions to ensure no one is left behind. Right. So there's a whole ass thing with this. Right. I vote Randstick purple. Thank you so much.
Metal Hawk, we need a color from you.
We need a color from you. Speaking of nylon, the scarcity created by World War II caused literal mobs when nylon socks were reintroduced. Nylon sock craze is the best history.
So, little tidbit from that era. Nylon was so scarce that women, in order to get that nylon look, because it was considered not classy to not wear nylons with your skirts, they would take tea bags and dye their legs with the tea bags and then take an eyeliner pencil and draw that line up the back of their legs to give the illusion that they were wearing nylons.
Huh.
So if you ever run out of nylons, everyone, throw some fucking tea bags on your legs.
Working with vaccine manufacturers to best serve the needs of local communities. So this is talking about trying to establish a federal sort of program for restructuring vaccine distribution networks, because currently, apparently, they're fairly inefficient. Right now, big cities are getting things a lot faster than smaller communities, and other disparities that are being caused by, well, private manufacturers rolling stuff out when they weren't really, their infrastructure wasn't really designed to deal with a pandemic.
Right. Even though this is the first fucking time we've had to deal with this, but okay.
So here's a big exciting one, talking about community outreach. Establish new federally supported community vaccination centers across the country. Knowing that not all states and jurisdictions may have the resources to scale vaccination at the pace the crisis demands, the National COVID-19 Response Team will utilize federal resources and emergency contracting authorities to launch new vaccination sites in support of state and local efforts to best meet local needs. The Department of Defense will bring its logistical expertise and staff to bear, with the Federal Emergency Management Agency, FEMA, managing setup and operations. These sites will mobilize thousands of clinical and non-clinical staff and contractors, including federal medics, Department of Agriculture staff, Department of Veterans Affairs staff, and the Public Health Service Commission Corps officers and DoD personnel, who will work hand in glove with National Guard and state, territorial, tribal, and local teams. I love that they actually mentioned tribal teams here, because the tribes have been getting hit very hard by this.
Hold on. Pink and purple. I have to manually do the colors now, so if they're off, please let me know. Hold on, something's not right. Wait, something's not right. Okay, that one. What am I doing? Guys, I don't know what I'm doing right now. Nope, wrong light. Whoop, wrong light. Okay, wait, what happened? I don't even know what I've named my own lights, and that's terrible. There, nope, that's pink. God damn it. I'm doing this on a color wheel right now for y'all. Okay, pink and purple. So, again, little tidbit. Currently, FedEx is grounded. Fucking grounded. The Memphis hub has had a massive delay due to the weather, because Republicans don't take care of their fucking infrastructure. And packages from as far back as the 12th and the 13th are currently stuck in the Memphis hub. They haven't moved. Only as of yesterday was FedEx able to only fly out vaccines. Yesterday. So we now have thousands upon thousands upon thousands of vaccines that are done. Can't be used.
So I just reposted the link for folks that lost their backlog chat. This is what we're looking at. We are on page 44 at this point. We're still looking at the second point on this plan. It's very wordy. There's a lot of rambling. Again, there's a lot of we're talking about things that already should have been done, because we need to handhold the Republicans, because the previous administration fucked things so badly that we're having to reset up basic infrastructure, so we can't do anything productive right away. They are talking about leveraging, just briefly, they're talking about leveraging storefronts for vaccine distribution, which is currently already done with the flu vaccine. They're also talking about giving extra support to government-run like community healthcare centers, of which apparently 1 in 11 citizens
government-run community healthcare centers would be like the health department. Would be who you're looking at.
Federally qualified healthcare centers is what it says. That's the
health department. The health department is federally qualified.
Yeah,
even though it's run by the state, they're federally qualified.
Mm-hmm. And it says also state and local efforts to enlist emergency medical services and firefighters to support vaccination efforts. Mm-hmm. So talking about utilizing those folks.
That weirds me out a bit, because I can see that being a very easily coordinated effort in larger cities, where the city runs the fire department and the city runs the ambulance services. However, when it comes down to smaller towns, a lot of the time, these are volunteer services. These people are not qualified to know how to administer a vaccine. and it's volunteer. It's not very well organized, especially in these smaller towns, especially when you go out to like the holler.
Well, it's talking
And
about it's talking about training and administration and also access to the vaccine. So
but
it
how
looks like
long
they'd
would that
be
take? How long would that take? The majority of the United States is not larger cities, it's smaller towns. So how long would it take to go into each and every one of these smaller towns that are serving 2 and 3 other smaller towns that are a volunteer only force to train everybody? That worries me a little bit. Cuz like is that feasible? Can we do that in the amount of time that we need to? Parker, we're not talking about paramedics. How about you sit the fuck down, not come in the middle of a fucking sentence, and shut the fuck up?
No, we're
talking about fire departments in small towns.
Yeah, because this is talking
Parker,
about...
they're fucking not. I literally live next to a town that is less than 2,000 people. Volunteer firefighters are not paramedics. They're lucky because we live in a military town where they have medics. However, if you go 45 minutes up the fucking road and you have a fucking town that's all of 275 fucking people, not a lot of those firefighters, not a lot of those companies are gonna have fucking paramedics. You worked in a small town. Your experience is not indicative of the larger. Now, when it comes down to medical emergencies like that, what happens is they wind up calling the sheriff, and the sheriff patches them through to the next largest town that has a trained paramedic or ambulance service to come deal with these people. When you are dealing with small towns that aren't even fourth rate, under fucking 1,000 people in that town, under 2,000 people in that town, you may not have a paramedic on an all volunteer fire service. It's not going to happen. Not everybody's going to be a paramedic, especially when you have a fucking town of 2,000 people that their families have not left in 6 fucking generations. Because when you make money like that, in order to be a paramedic, and in order to work in the medical field, they don't have medical centers in these towns. You wind up moving to a bigger town for a job. So kindly sit down, shut the fuck up, and let this be a lesson that your fucking experience is not indicative of the whole. And instead of sitting here and coming in like some blowhard asshole, perhaps you should sit down instead of telling somebody, no, you're wrong. Sit down and listen to the fucking discussion. Thank you.
All right, Jen, take a breath, change the lights. Also, Victoria brings up a good point, though. Apparently, the particular method that was used for the COVID-19 vaccines can be video trained for volunteer folks.
Like, I live next to Kentucky, man. I ain't trusting these people to look at a video when they stick a needle in my arm.
I mean, I know that's how. The point being is that is an option, though, if it comes down to it, because we're in an emergency.
But I'm worried about it. You know what I mean?
So here's another big one. Partner with tribal nations and other key entities to support effective and equitable vaccination programs.
I like that.
Given that the tribal nations have been heavily pressured, especially in Republican states, to say not screen people coming in for COVID-19 and stuff like that, this is actually a really big deal, especially because I don't know if any of you have ever been to a res, but like for a lot of them, that is not exactly swimming with money. People think that like the casino, income goes to everybody, not in all tribes, and often the percentage that is kept for the people is not very much, especially when you consider things like a lot of that money has to go to things like maintaining roads and stuff like that. That might be the only infrastructure cash that tribes can get.
Can we highlight what Dylan is saying too? This is another really... I will say my father is a firefighter and safety coordinator, and even he disagrees about this. An actual firefighter volunteer disagrees to administer. If he asks, he will let the doctors do it. So this also falls on if they're going to be okay to do this. Hold on. I wasn't trying to be an asshole. I'm trying to listen, but as a paramedic who has worked as a volunteer in a small town, it can be done. Further calling me an asshole. I don't give a fuck about how you feel about being called an asshole. Fuck off. I don't give a fuck about that. Whatever.
Oh, apparently I'm getting to choose this color.
Again, you are sitting here and talking about indicative of your experience. What happens in your backyard is not indicative of the whole. Your view on that, instead of you crossing your hands here and being like, well, that's not how it was done where I did it, so she's wrong. That's exactly what's leading people to freeze to death in Texas right now.
So let's be
that attitude.
Let's be tiny bit nicer for a second. Please consider your phrasing next time you are trying to talk about it can be done versus it already is being done everywhere. The way that you phrase that very much came off differently to Jen and to I as well. If you need to clarify, please do clarify next time that you're talking about a particular small town and that you think it's possible for that training to happen, not that you think that it is happening everywhere, because that seems to have been the disconnect.
Thank you. So
for those of you who didn't notice, I started as a debate moderator. So my choice is
those of you who don't notice, I don't do debates.
Well, I started in the community as a debate moderator. So like getting people to stop yelling at each other is generally my forte. It's the reason why Jen has the leash. So I'm going to kind of skim through the rest again. I linked the document.
But I want to talk about the reservations really quick.
That is a big deal.
Yeah, you had mentioned that, everyone thinks that reservations are rolling in money. They're not. You have to understand that, yes, while they have opened casinos and hotels and stuff like that on their lands, the lands they were also given were unsustainable to life. They were not sustainable to life. So with that money, they're literally feeding their tribes because the lands that they were given, they can't grow anything on it. It's hard to put shelter down on it. And every year they encroach more and more and more on that land. So they're losing it. So you have to understand that too. Also, the fact of we still have to face, excuse me, I had Wendy's tonight. That was not a good idea. Especially when you eat a Frosty and then chicken nuggets. It wasn't a good idea. When we still face discrimination when it comes down to schools and medical training. So while they may have a, what's the word I'm looking for? Cultural medicine person within their tribe.
I completely agree with Nervardia there, by the way.
All right. They may not have somebody that is educated on vaccines, on how to administer them within that tribe and within that location. And it's also the fact that they are so out of the way. Like I said, they don't have major medical centers there. So when you do have somebody that is educated in that and has decided to pick this as a career, these people will wind up leaving that area to go work. So we need more focus on reservations. We need more focus on urban areas. We need more focus on rural areas because these are the areas that by and large don't have access to the medical care that many other people are used to. So we need to send people out there. We need to have trained professionals that can administer needles properly, they know how to track shot records properly. We do need to start sending people out to these areas that aren't in major cities, that don't have an abundance of medical care to them. There are some areas in Kentucky, the Holler, which is so rural that people are literally lining up for dental care and medical care 48 hours in advance in parking lots. This isn't a place that has high medical training. This isn't a place that has high paramedic training.
I mean, hell, even in Seattle proper, actually, there are free vaccination days that went on when I was a kid.
Parker.
Okay, so that actually is an apology, and I know that you.
No, but it's not. It's not. It's not a fucking apology. That's backhanded. That's backhanded. I apologize for what I was hearing was. I have made myself abundantly clear. I have repeated myself, which I don't fucking normally do. We are not talking about traditional EMS like this. You are blowing past the point that your experience is not indicative of the whole. Just like I was talking about out in the fucking holler where they don't have medical training, they don't have hospitals, and they don't have volunteers in their fire departments to go through a town and administer this, where their fire departments are literally guys getting hoses out of their fucking yard. You are consistently blowing past the point I make to constantly sit and rail the fucking point through. There is a time when you sit there and say, okay, I'm going to shut my fucking mouth, and you do it. Period. We get what the fuck you're saying. It's you sitting here and blowing past the point of what everyone else is.
That's fair. But while we're kind of on that point, I do want to highlight Nervardia's comment again really quick because I didn't want to make you lose your thought, but this is an important point. The people that are giving the vaccines are at risk of infection. They should not be volunteers. Pay them. I do agree. Small towns often don't have very much money, but that's actually more of an indicative of a gap in funding, like for public health services in a lot of these rural places that needs to be fixed with better management of finances, which doesn't mean austerity. It means that maybe the rich might need to pay a little more rather than being able to, say, have Amazon get a tax refund. But coming back to this, while we're on the subject of distribution, this is actually a really important point. One of the things that I was talking about to add to your point was that, like, we used to have these free vaccine days in Seattle when I was growing up. Now, granted,
we have them too.
With the expansion of Medicaid, there's significantly less of this going on because we took the Medicaid expansion. So most people are on Apple Health now and actually getting health care. But I remember like Westlake would have these and they would happen like once a month for all 3 summer months leading up to school. And there would be lines wrapped 2, 3, 4 times around Westlake Park to try to get these vaccines. Because people just could not afford vaccinations. And vaccinations, if you have insurance, are one of the things that you can get for free most of the time. But most people don't have insurance.
And that vaccinations didn't become free until the Affordable Care Act.
Looks like we are going to be opening up.
I wrote that down.
It looks like we are going to be opening up at least 5 more slots. It's going to take us a little bit more time to get through this because we got into an argument with the chat.
So, and to preface that, vaccines did not become free until the Affordable Care Act. Prior to the Affordable Care Act, you still had to pay your co-pays and your, what's the word
co-insurance.
Deductions. Co-insurance deductions.
Co-insurance deductibles and co-pays. We should do a stream explaining insurance
one of these days.
Day.
But you had to pay all of that shit. I got to
navigate all of this.
You had to pay all of that shit, and then you had to pay lab fees on top of that for them to formulate the vaccine in order to get vaccinated.
And that's only if you were lucky enough to go to a hospital that was in network, which again...
So what they would do, like in my neighborhood, or what they do now in where we're at my son's school, they actually have people from the health department now that come around, and they did it back when I was a kid too, that would come around and they would vaccinate us in the gym. This also happens with fluoride and dental treatments in the South. The South doesn't have very high fluoride content in their water, which is horribly detrimental to children. So what they do is they line all the kids up in the gym, and they have kids like once a year do these the fluoride rinses. This is the kind of shit that we're dealing with. Like everybody, and this is what a lot of people have a hard time understanding and remembering, is that when you think of the United States, people think of New York, they think of Los Angeles, they think of Atlanta, they think of Miami. But the majority of the United States is these small towns where vaccines are happening in gyms and fluoride treatments are happening in gyms. And it's usually volunteers that are doing it. It's nurses from larger hospitals that volunteer their time to come to these smaller towns and administer these.
So while we're on that topic, the last bit that I want to take from point 2...
not red. This was the not red color.
Yeah, 1 red and 2 not red. You get to pick the other 2 that are not red.
I'm going to do that.
So we've opened up 5 more slots. It looks like Ikeda has taken the first of them. Oh, shit. There's an Amber Alert going on. Fun. Oh, on my phone just like popped the hell off with an Amber Alert. And it's actually pretty close to where I am, but like I'm not on the road, so I can't help. So last point kind of on section 2 of the PDF document that we're looking at. We're on page 47.
I really want to just touch on this real quick. Demonic, what they do in the beginning of the year is they send a form out that states, the health department may come and give fluoride treatments, they may come and give vaccines, and then the parent has to sign off on it. If the parent doesn't sign off on it, then the child won't receive it. So they do have a way out with that.
Ensure no out-of-pocket costs for vaccines. The administration is committed to ensuring that safe, effective, cost-free vaccines are available to the entire U.S. public, regardless of their immigration status. That's a big deal right there.
That's a big deal. That's a huge deal.
Just because you overstayed your visa doesn't mean that you should have to die or kill your family. Just saying.
Also, President Trump did not want to extend this to people with non-legal status. I will not call somebody an illegal person.
That's why I made the joke about just because you overstayed your visa, because the thing is overstaying your visa is the majority of immigrants that are here.
Yeah, it's overstaying your visa. And the reason why it's so common is because with each president that's been handed, the visa laws have been changing, and they're afraid that they're not going to make it. Also, a lot of people
Tiralana, that next one is mine. We haven't gotten there yet. We're still going through the list, and we do them in order.
Yeah, we'll do them in order. So and a lot of them are on H1 visas. Now, H1 visas are stupid fucking hard to get. You basically what happens with an H1 visa is a work visa. And what happens is this company has to say that they don't think that they can find a qualified candidate to do that job in the United States. So they have to find somebody from another country, and they have to prove that. So that's the only time you get accepted for an H1B visa. I think I call them H1 visas. When people are losing their jobs like crazy, when the job market was already going down before COVID, and then COVID hit, you now have a bunch of people facing going back to fucking terrible countries because they don't have jobs. Because there's been no safety net for jobs put in place. And it's
well, and there's also like migrant workers. Trump was dumb and made it nearly impossible for migrant farm workers to get here. So farmers are getting hit. If you guys haven't noticed, there's a lot of produce that we haven't gotten this year. I'm angry. Like, I'm fucking tilted because my satsumas that I love every year didn't come in December because they weren't allowed to be imported because of some of the restrictions and the dumb way that they were implemented.
Let me tell y'all, we've been seeing food shortages here for months now. And a lot of it is fresh produce. We ain't seeing shit out here. The grocery stores by me have consistently been low stock, bare. Now there's nothing. Somebody posted pictures from the local Walmart by me today. The produce was gone, completely bare. The bread was bare. Meat was bare. Dairy was bare. Because we had already been struggling with supply issues because of the migrant worker restrictions that were put on.
Let's see. So we are now on page 54 for those of you guys who are following along at home, because again, there's a lot more rambling. There's one more point that I wanted to make about the vaccines, and that is also that Americans overseas are going to be getting them.
I just want to address Midnight Mist.
Oh, Midnight Mist. There you go.
When it can be an environmental contaminant. However, what's usually done is during water treatment, that is when it's added. It's at water treatment processing plants is when it's added. And while it's not just like, they're not just dumping it into a fucking river and being like, okay, we have fluoride now. Yeah, it's not being done like that.
So this is where we're starting to get into the meat of things like executive orders.
I'm getting it, guys. It's a thing. I have to do a color wheel right now.
Executive order protecting the federal workforce and requiring mask wearing, which was on the 20th. Executive order promoting COVID-19 safety in domestic and international travel. That's the one that we mentioned at the beginning of the stream with the buses and planes and such, mass transit. Executive order establishing a national pandemic testing board and ensuring a sustainable public health workforce for COVID-19 and other biological threats. So we started to get into that a little bit, but the testing board we haven't really got into. We are currently running on... The effectiveness of the test is high enough that they got approved, but they were approved on emergency orders for the pandemic. Our tests have something like a 20 to 30% failure rate or false negative rate for some of them. It depends on the manufacturer, which like some of them are up to 20%, some of them are more effective. They have not gone through the rigorous testing, quite a few of them that needs be. We're kind of in a trial by fire for quite a few of them, and the FDA has not officially approved anything for mass commercial use. Currently, there's only emergency compassionate care use, which in the healthcare field, for anybody who's familiar with that, drugs will sometimes be approved for what's known as compassionate care use. It basically means that they're being approved for a use that is off-label in cases of an emergency. Tests were approved in a very similar fashion by the FDA.
Yes, and this happened with SARS. This happened with... It happens during a cold and flu season, all the time. Like they'll just be like, okay, this, they'll figure out the strain of flu this year. People come to a hospital and they'll be like, oh, so this kind of weird thing that's not usually used for the flu actually helps alleviate symptoms and helps people breathe better. Yeah, fuck it. We'll sign off on that. No worries. No worries.
So, executive order as well, ensuring a data-driven response to COVID-19 and future high-consequence public health threats. We've touched on that briefly a little bit too. Mm-hmm. Basically, he put forward an executive order that established a method or established the requirement to create a method of mass collecting data for the CDC, because part of the failures of the Trump administration was that they were suppressing data and trusting the states far too much with theirs. So let's talk a little bit about that.
Right down to, there was a doctor in Florida who, and I may be getting the story wrong, but this is where I got the gist of it from. There was a doctor in Florida who refused to manipulate data and wanted to put out everything, and she was subsequently fired. She then, and this is where she fucked up, after she was fired, she still accessed the files to that, I believe it was a CDC center in Florida. They then came into her house, confiscated her computers, and arrested her. Like, they confiscated her computers and arrested her because she did not want to manipulate data to satisfy the Trump administration.
So here's another one. Support businesses and others for implementing effective infection control practices. The Small Business Administration will provide technical support for businesses and others for implementing effective infection control practices, including administrative controls, engineering controls, and personal protective equipment. The SBA will also work to develop incentives to encourage small businesses to adopt adequate infection control practices, including effective and enforced mask wearing policies and other social distancing policies.
I just want to hit a conversation that's going on in the side chat. Yes, normally fluoride should be in our diet, but the U.S. diet absolutely sucks and is pretty unhealthy. This is double-edged. The reason
there's also fluoride being good for your teeth in water, which is one of the ways that you can get it.
Right, but when it comes down to, yes, and fluoride is really good for bone structure and for teeth. However, they have found that the greatest way and most effective way for it to hit your teeth is water. However, yes, that I maybe didn't have to. It's been a while since I looked into that. However, the reason why American diets suck is because despite the fact that people think we are one of the richest nations in the world, we are actually one of the poorest when it comes down to food insecurities and when it comes down to supplying food for our country. Our tariffs are out of control. We have over-farmed our soil to the point where a lot of foods won't grow anymore on it, and we are not given the education on how to eat sustainably for ourselves, to where if you look in countries that do have lower fluoride content in their water, like the Scandinavian countries, they also have social programs in place and are also teaching people from a very young age.
So I happened to check right when it was about to go off.
Oh, what? Oh, okay. What they're teaching people from a very young age how to live sustainably through agriculture. So this isn't just, oh, we have to stop putting fluoride in the water. There are things that need to be done far more in advance before that happens.
So it would be the next color, whatever it is.
My pick. I'm going back to red just because it's fucking easy.
So here's a big one, though. We've been talking about disenfranchisement and disadvantage. Maximize accessibility through free testing. President Biden issued an executive order establishing the National Pandemic Testing Board, blah, 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 that whole big long thing, directing agencies to facilitate testing free of charge for those who lacked health insurance and to clarify insurers' obligations to cover testing. There were insurance companies that were refusing to cover COVID-19 tests for a little while. This basically makes it a federal mandate that if you are an insurer, you have to cover it.
I need to address an American stereotype from Cassandra. Cassandra, this people eat at fast food places too. Americans largely don't eat at fast food places all the time. The problem is that we are extremely food poor and our wages don't match the cost of living. So what people are buying at the store are very high carbohydrate, high fat foods that are meant to keep you fuller longer, which also happen to be very cheap and very fatty. The whole Americans eat McDonald's and fast food all the time, that's a really bad stereotype and misconception of Americans. I will tell you, honestly, when I lived overseas, when I lived in London, when I stayed in Tokyo, the people around me, minus the exception, I want to say minus Italy, minus the people around me ate out far more than anyone I ever knew living in the States. Like, way more. Pub food was constant. I remember up in Norway, granted the restaurants were closed earlier, but people were getting in and out of there. Ireland, huge takeout. Nando's, huge takeout. Tokyo, street food. So this misconception that all Americans do is eat greasy fast food is such a bad stereotype. It's not that we're choosing to eat fast food, because in reality, fast food is actually very expensive and it's considered a treat. The reason why we have such poor diets is because our pay does not match the cost of living to afford healthy food.
So, and not only that, like, there's also the food desert problem. We should do an entire stream at some point on food.
But it's also the fact of,
like, that was my specialty, actually.
Like, also the fact of, when you're working 80 hours a week for minimal pay just to pay the bills, you need to find something that's going to sustain you from breakfast until dinner. When you're eating high greens and very healthy food, that shit digests in your system real fucking quick, and that's not going to sustain you.
Well, and so I will be honest,
high in fat, high in carbs.
And you can actually, like, it is possible to eat very healthy for very cheap, but the amount of labor involved for folks that are working often 2 jobs, and the skill involved as well, like, even with assistances with things like pressure cookers and slow cookers, you can eat really healthy, really cheap. It is possible. Do people have access to that food? Do they have access to the time and labor that they would need to put in? Like, do they have access to the equipment that they would need in order to ease it? There's a whole entire thing. And again, Jen and I have talked many times about potentially doing a stream like this. We just need to schedule it sometime this year.
But Cassandra, it's not just processed foods. Like, I'm going to tell you right now, growing up in New York, in the projects, in the hood, most popular thing was a chopped cheese sandwich. Now, I'm going to tell y'all what a chopped cheese sandwich is. A chopped cheese sandwich is what you guys would call a sub roll, a hero roll with ground beef, a lot of cheese, and I don't like hot lettuce and hot tomato, so I wouldn't get it on it, but people would get lettuce and tomato on it. That's not processed foods. These are foods that can be used in a very healthy way. However, we were working and going to school from 5:30 in the morning until 7 o'clock at night. I got one break in between my classes and my job that was a half an hour. So I had to pay bills. I had to be an adult. No, that's a federal mandate.
I was about to say that's a federal mandate. However, there are some states that don't do a very good job of enforcing it. That's the issue.
Oh my God, Carpathia, chopped cheese was fucking delicious. But it's really fucking bad for you. It's white bread. It's cheese. It's
our version of that
meat.
is something. Our version of that is something called pink macaroni. There we go. It
was big macaroni.
Ramen, whole milk or half and half, tomato sauce, fuckloads of cheddar cheese, and whatever meat you got in the fridge. Usually ground beef. Pink macaroni.
So it's not ramen. Even processed foods. I remember growing up.
When is my choice coming up, by the way?
Now.
The prettiest, most intense blue you got. You know what my favorite color is?
Which one? The blue?
Yeah, the blue.
The blue?
Yeah, it's that sunset blue that I really like. The bright blue.
Let me see if I can hit that on the color wheel. But it's not just processed foods either. It's literally foods. It's regular food that you find cheap that can fill you up. It's not just processed foods. And this is something that I remember going overseas. I used to have a bunch of people look at me and they'd be like, "You're American. Why are you so skinny?" I remember that. And I'm like...
Thank you so much, Akeda.
At the time, I was doing well enough to eat well. And I remember dating my ex and being like, he would want to go out all the time. And I'm like, can we just cook? Can we just cook something? And it's like, oh, but European cities are different. We center so much around major cities that nobody really cooks. And I was like, wait, what? Let's see. What's the most intense? That is the most intense blue I have.
That is beautiful. I love that blue.
That's the one I got.
So here's the next.
That's just a stereotype that irritates me, to tell you the truth. Sorry
the next
sorry
sort
about
of
my high horse.
and Carbuncle actually brings up a good point, or the ability to cook. Chronic pain and that sort of thing. I actually have this problem where sometimes the guys will have to cook because, like on Monday, Jen and I talked about part of the reason the stream didn't happen on Monday was because Jen was dealing with rolling blackouts. I was in so much pain I could hardly get out of bed on Monday because I have chronic pain and my pain just decided it wanted to be mad that day. Next part, we are on page 61 for those following along in the audience. Develop basic preclinical tools required to develop new antivirals directed against the coronavirus family. So the Trump administration didn't want to provide federal funding for treatments. He just was like, hey, we're going to encourage people to patent it. And like, the market will
what
take
he
care
wanted
of this.
to do was he wanted to follow these bunk science doctors that were, I forgot the fucking names of the shit that he was fucking pushing. But he wanted to be seen as, I can solve this faster than any world leader, that any medication that was brought up, suddenly it worked. And if it was proven not to work, then it was egg on his face. So he didn't want to keep funding research to it because according to him, it was like Iraq. 2003, we got a thing that says mission accomplished, and here we are 15 years fucking later, still fighting. It's that. It was the egg on the face moment. If they still did research about antivirals and other medications that could help, then Trump would have to backtrack, and they would say, well, no, what I said was this miracle cure isn't. That's why he did that. My child is stomping down the stairs. Hydrochloroquine. That was it. Yeah. Thank you. It was hydrochloroquine.
And also, he also at one point talked about injecting cleaners into your veins or something, which was dumb.
Yeah, Donald, let me get a fucking giant UV dildo and I'm going to shove it so far up my ass that when I have COVID, I'm going to shove it so far in there, the UV light is just going to come radiating out of my fucking chest because it's just naturally hitting my fucking lungs. That's how I'm going to fucking cure COVID.
So the last bit for this section that I wanted to cover was he's talking about federal funding to expand and develop the use of potential antivirals and other therapeutic treatments, and also require them to be covered by insurance or the federal government for uninsured people. Yeah. Also, he's talking about needing to increase clinical care capacity. It talks about, there's this graph here that's kind of chilling for those of you that are following along at home on page 64. 25% or more, that there are at least 7 states that currently have, that are over capacity by 25% or more. Mm-hmm. Yeah. In terms of inpatient beds, that's kind of scary. There's one of them, by the way, is Kentucky, which, a certain like cult leader that we happen to know has been holding gatherings there.
I'll tell y'all what's been happening here. I live in a moderately sized city surrounded by a bunch of smaller towns. Our next major city is over an hour away, where all the medical centers are an hour and a half to 2.5 hours away. When we started getting hard, because I live in between like so many different borders, that we were getting people from all over the place. So when the numbers in the area started to spike, we don't have a hospital built for something like that. Red and yellow. Give me just a minute to get this sought out because I have to do a whole thing right now. And then I have to sit here and figure out why this shit's not working after the show. They were having to fly people out because we just don't have that capacity. We've never had to deal with this level of ICU capacity before. But how do you fly out a patient that needs to be sedated and on a respirator? How do you do that? You can't. You can't. And this was happening around all these small towns. And they were having to fly them out to major medical centers, and then the major medical centers got too full. Eventually, what wound up happening was many cities would sit and determine, and this happened in Italy as well, what is the life expectancy of the patient. If the patient was old, if the patient had too many pre-existing conditions, if the patient was too far gone, then they would just send them home. because they considered they weren't worth saving and weren't worth holding the bed because they didn't have it. And now we've got people, like I said, when it comes down to the holler, and when it comes down to these really small rural towns, you've got a choice of either letting them go home to die or putting them on a 2-hour helicopter flight for the nearest medical center that has a bed to take them that they may not survive because you can't vent them on a helicopter. This is what we're facing.
Well, and
this is exactly what it's like.
On pages 73 and 74, it talks about using the Defense Production Act to ensure that we are producing adequate ventilators using the federal government's money, as well as testing and vaccine supplies, which we covered briefly at the beginning.
Right,
but to hammer it home,
this isn't a ventilator thing. This is literally having the beds available to even have people be admitted to be seen, to be treated.
Well, yeah, I talked about how when my husband ended up in the hospital the second time, they had closed down the lobby and there were triage folks being triaged in the lobby, and there were beds that were in the triage rooms because they were so over capacity. For those of you who don't know, Washington was the first state hit. We were ground zero for where it first came into, where it was first detected in the country before it hit the East Coast. We had the first dead. It was community spreading by the time we even found it here, and it hit us like a fucking freight train.
I'm going to tell you guys right now, New York was fucking wild, man. I was getting pictures from people where the traditional emergency room, like, you know, when you walk into the emergency room and they have that area where people sit, the waiting room, and, you know, you talk to the fucking receptionist and shit, those were totally blocked off with patients. Vented patients. Like, they turned the waiting room into, they just hung curtains on the wall and had people in comas ventilated in emergency waiting rooms. The triage was done in the parking lot. They were fucking asking people what's wrong, triaging people in the parking lot, and then taking their phone numbers and then telling them to go wait in their cars.
So here's one that you're going to want to rant about, Jen. You want to get mad again?
Columbian Presbyterian. I'm not talking about fucking Parkway Hospital, Forest Hills fucking hospital. I'm talking like Columbian Presbyterian was doing. Beth Israel was doing this shit. Major fucking medical centers were doing this.
Yeah, we had the place that I was talking about, Valley Medical Center, was outside the main city.
A midnight mist. We were having that problem here in the South as well, to where they were converting cardiac wards. I can't think of the name now. Endocrinology wards. They were converting them to ICU beds to the point that if you had a heart attack, they couldn't see you. They did not have the ward to see you. This is currently happening in the South. The only time now that they're telling people to come in certain hospitals is if they have been in a life-threatening fucking accident. That's the only fucking time. If you had a heart attack, if you have cancer, something's going wrong with that, they're actively telling people we can't treat you here because we have COVID patients in these wards. Like, this is the kind of shit that's happening. It's fucking unfathomable.
So now we're getting into the safe reopening of schools portion, which this is a part where we're going to be a little less positive for a hot second here. I mean, granted, it's a good thing that they're like, hey, let's ensure adequate supplies for the schools because, like, that's not being done at the state level by any state ever unless you live in a rich area.
I just want to touch on Cassandra's question. North Dakota is currently the state with the... North Dakota has the most confirmed COVID-19 cases per 100,000 population. 12,966 per 100,000 people. North Dakota, South Dakota, Rhode Island, Utah, Arizona, Tennessee. Rounds them out.
So they're talking about in here implementing a federal program of COVID-19 screening for schools.
I'm listening. I'm just taking note of...
The problem with screening, though, is that, like, the test is good for how long? Until fucking mom brings it home and now, like, the kid's got it.
Right.
Develop and release detailed technical guidance on safely reopening schools. Work with governors, local school leaders, educators, and unions to better understand barriers and shape policy.
Me personally, I feel that schools should not be open until all teachers and all staff have been vaccinated. I think that teachers should have been in the 1A category. Is that what? Yeah, 1A. They should have been in the 1A category. If you want to open these schools, then you need to get these teachers vaccinated, because like you said, what happens? The teacher comes in, little fucking Timmy's mom is an essential worker. Timmy's mom's got it. They don't know yet. Now Timmy's fucking got it. Another thing is, what the fuck?
Or Janice's mom is an essential worker who's an anti-vaxxer, refused to get the vaccine.
But even look at it this way. Timmy's mom is an essential worker. She can't afford fucking childcare. Nobody's going to want to watch a sick kid. What the fuck does she do? She either pays the rent or she fucking, takes her kid out of school. If you want to safely open up the schools, you got to vaccinate the teachers. And not even just the teachers, the whole fucking staff. You got to vaccinate the whole fucking staff. Janitors, and lunch people, you got to vaccinate fucking everyone.
Well, and we've got Mero coming on next week to talk about how we don't know, and this is scary, but this is not a reason not to get the vaccine, because it'll still potentially save your life. We don't know currently with their data whether the vaccine prevents transmission or merely stops you from getting symptoms.
Right.
We don't know that yet. So you could have it after getting the vaccine, not get sick, which is good, by the way.
Which is
you do
good.
not want the fucking long-term complications that I am still currently dealing with. My heart being fucked up, my lungs being fucked up, my hair loss. You do not want these. Like, part of the reason that you keep hearing my voice catch is because, and part of why I keep muting, is because I've had a chronic cough since I got over COVID. Yeah. My lungs are damaged and have reduced lung capacity, and the scarring causes a chronic cough. So when you hear my voice catch, that's me suppressing that. You don't fucking want that. You don't want the higher risk of clotting. You don't want the enlarged heart. Right. You don't want the weakened heart muscles and lung muscles.
You may still be able to spread it. So honestly, the only way we're going to beat COVID is getting as many people vaccinated as possible. Because we could sit here and pass this shit to fucking everybody, but if you're not going to get sick, you're not going to die.
But the thing is we don't know if you not having symptoms, because, again, we don't have enough fucking data yet. Yeah. We don't know if you won't get symptoms, but you could give it to your kids. You could give it to your teachers. You could give it to your friends. Just because you got the vaccine doesn't mean that you don't have to wear a fucking mask. Just saying.
Right. Shabiz, I'm curious as to how long after the vaccine they were symptomatic. I'd be curious to see that, because it is showing that if you have had COVID I think it's within the last 90 days, you're going to have a reaction. You are going to get worse symptoms because it aggravates whatever little remnants are left from the virus itself.
Well, and beyond that also,
all right. No, full fucking stop. Full stop. Shabiz, I don't want to hear vaccines are not an end-all cure. Literal fucking history has proven that wrong. We have eradicated major diseases on vaccines alone. So if you come here with this anti-vaccine fucking fear-mongering bullshit, I am personally...
I think that this was actually supporting what I was saying about vaccines not being the end of it. Because I was saying that...
But that's the thing, is that we don't know. But to turn around and say vaccines are not an end-all cure, that is just blatant-ass misinformation. Well, yes, and that's exactly what we're saying. They can contract COVID after the vaccine. What I am saying is...
Okay, yeah, Chibichi confirmed that they were... Okay. Confirmed that they were saying that I'm right about that.
Okay, yeah. If you want to stop people from dying... We've got to get as much of the population vaccinated as possible. And this is where I fear for people who can't be.
Okay, yeah, Chibichi was agreeing with me there.
Right.
Just so you guys know, there is a slight delay between what you guys are seeing and what we're doing. That's just a part of being live. So if it's taking us a second to catch up on your end, we're not continuing to argue with you. It's just that there's a delay. That's what it is.
So this is what I worry about, especially people who can't be vaccinated. What do we do? Because if we could sit there and we can get everyone fucking vaccinated, right? We could sit here and pass this shit to each other left and right. If we're all fucking vaccinated and it keeps us fucking safe, straight. Ain't nobody gonna fucking die. And we kind of... And that there will also be...
This is true. Victoria, you put it excellently.
Right. Mero may be able to help me out with this. vaccines can also de-evolve. So if they're not allowed to go running rampant and spreading and being contagious, they will de-evolve to a point that they're nothing.
Well, at the very least, they can't keep mutating to become more virulent and more deadly.
I believe they can also de-evolve to be less severe. And
I don't know. I don't know if that's the case. I've never heard anything on that, but we can ask Mero about that when she's on.
Yes, and if that's the case, then we get as many people as we can vaccinated. COVID turns into a common fucking yearly cold.
Oh, Chibishi, it says that they work at a COVID lab.
Right.
So yeah, there we go.
Chibishi, maybe you can answer that for me. As from what I know, viruses can de-evolve to be less severe. And if that's the case, let's get who we can vaccinated. This way it's not flying at the contagion rate. This way it's not as severe. And hopefully we have a shot at de-evolving it to where COVID just becomes like a common cold.
Well, and part of the scary thing with COVID also is that these vaccines are between an 85 and 90% effective rate, which means 10 to 15% of the populace could still develop symptoms. Right. Depending also, we don't know on what data that happens. We don't know if there are some people that just don't take it. We don't know if there's a mutation that has caused some strains of the vaccine, some strains of COVID to not respond to vaccination. We don't know if there's some...
666 just mentioned that about the South African strain. As far as what I heard 2 days ago, the Moderna vaccine has actually been shown effective on the South African strain because we're dealing with the South African strain down here in the South now. We're dealing with that here. So,
yeah, well, and there's also the UK strain, which is significantly more deadly. And a lot of us that got it back in March when we had the Chinese strain coming through, which I don't know what the names of the strains are, actually.
I'm still unsure. I think my son had the European strain, just judging on where we are in the country.
Well, and again, I don't like using, Mero did a whole amazing video on why using, regional names for strains. Problem is I don't actually know the name of the strain I had.
We could say Asian strain.
It wouldn't even the original strain. Let's call it that. The original strain that came through, from overseas. The first strain that hit the United States is the one that I had. The one from the UK is also known as the European strain, but there's another name.
No. The one that they found infecting New York was actually from Italy.
So the Italian strain, that one's more virulent. The UK strain is supposed to be a lot more deadly. And now they've discovered another strain that's even more virulent and deadly.
We have 7. We have 7 new strains now in the US.
But it can become less virulent because high death rates can cause the disease to die out quickly.
Right. We have 7 new strains now in the US, actually. 7.
Yeah, so I don't know what the numbers of all these strains are, and nobody told me what strain I had because we weren't tracking strains when I got it. It was at the very beginning of the pandemic. I got it at the end of March, beginning of April. So again, I can't give you guys the number of my strain. I'm using the colloquial terms because I don't have access to the other terms. But what I'm stating is that we are currently tracking 7 different strains, and we don't know which of those will be responsive to these vaccines. These vaccines were based off of samples that we received from all over the world, but we don't know which ones, especially the newest ones, might not be covered by it.
So, Navardia, I learned that sometimes being too, I can't say that word,
virulent,
evolutionary disadvantage. You want to know how I learned that? Playing the Plague Inc. game. Because I would make my viruses so fucking strong that it would just kill before it could spread anywhere. It would just kill too many people, and it would kill people before it had the chance to infect people. And I was like, oh, I lost.
So here's the next part of our Biden plan, because we're getting pretty close to the end of the most important stuff. Strengthening OSHA guidelines for specifically safety around the virus. Let's talk about that, because first off, OSHA contradicts itself constantly. It's a running joke, but OSHA saves lives. Those regulations are written in blood.
OSHA has left the chat. We've all had an OSHA has left the chat moment. We have all had that. We have all had that.
Thank you so much, Akeda Hakubi. Have Callan lead a ritual to all the gods of pestilence. The plague will end one way or the other. Are you sure you're an atheist, Akeda? Are you sure?
I want to know who pissed off Scotty. I'm convinced at this point that the reason the South is getting this weather is because Scotty had enough.
The north wind brought the polar vortex.
I am convinced that Scotty had enough of fucking the South acting like assholes spreading around fucking COVID, And she was like,
Press F to pay respects for Jen being able to pretend she's an atheist anymore.
now nobody's going out. Right there.
Here's another big one. Your big one right here. Provide paid leave to workers that go into quarantine and isolation.
Why is this not a thing already?
Why is it not? But this is a big deal in this country of y'all are supposed to just like pick yourself up by your bootstraps. It doesn't matter how hard you fall on your ass
Miss
trying.
Skadi. Skadi is one of the Norse gods of the mountains and kind of hunting and winter and stuff like that. Skadi, Skadi. I also speak with a heavy New York accent, so how I pronounce things is way fucking different than most people.
Also create conditions for worker vaccination through a national employer pledge. No worker should have to choose between earning a paycheck and getting the vaccine.
Seriously. And that second one fucking knocks your ass out for a few days, too.
Providing assistance
is it
with
Scotty or Scotty? Because I always thought it was Scotty.
I have no idea that I'm not a heathen.
I have always been... Skull is something different. I have always been told it's Skadi. Yeah, snow hunting and winter stuff, yes. Yeah, okay, everyone's answering. I think she just had enough people spreading fucking COVID and was like, fuck off. Nobody's going anywhere now. Knock your shit off. Fuck off. Camera, okay. So that's big because especially that second round of vaccine knocks your ass out. Big time.
Oof. Native Americans have been hit like the hardest in terms of cases, hospitalizations, and we are second to African Americans and Latinx, which are equitable in terms of death, but only by a little bit.
Something else I want to touch on that Biden, I don't know if it's in this one, but
thank you so much, Variance.
Thank you, Variance. Biden is also trying to sneak in a $15 minimum wage law. He's just like, in there, we're gonna.
That's gonna go in the COVID relief.
We're gonna slip this in here, and this is.
I mean, we've got control over the House and Senate and tie-breaking power right now, so.
First,
might as well.
Yeah, right. He's like, 1,400 checks, which people are pissed about. They're like, fuck you said 2,000, right? Whatever. But it's like, oh, we'll give you $15 an hour. Like, he's trying to, like, slide this in to, like, pad the fucking deal. Republicans ain't gonna go for this shit. And this is what worries me. Is, we have these great plans and we have...
the alarm never went off, but it did
That was the last one.
Oh, we don't have any more colors. All right. We're going to be starting to wrap up within the next 20 minutes, but we probably are going to have at least 2 or 3 more slots if you want to declare color variants.
Actually, I'm going to try to, because I still have to record.
Well, I'm saying we're going to be wrapping up over the next 15 minutes. Yeah. Because we're going to be doing that, we might as well at least let people change the colors a couple more times.
Carpathia, that fucker. You could... I love him. But I cannot... So, I have a room in my house that's a cold sink. I call it a cold sink. And it's where my toilet is. But it's the wall where the pipes are for the toilet are surrounded by other walls. And like closets and shit. So if I don't maintain it, my fucking toilet is frozen when it's cold like this. So I have to keep open the pantry and my bedroom closet.
Variant says purple.
This fucker. The minute those fucking doors open, I have had boxes of cheesy noodles all over my fucking floor today. My clothes are all over the fucking place because he's got to go fucking jump and run. This fucker. And look, he's so cute. He's so fucking cute now. Look at him. Oh, the booby. No, the booby's a dickhead, okay? He's a fucking asshole. Because it's 2:30 this morning when I'm like, finally fucking sleep. No, my fucking tank tops come down. That asshole. Right there. He's now napping to do it again tonight.
Hey, Jack and Quill. Let's get a round of applause in the chat for Jack and Quill, who is the artist of the fantastic new emotes that everybody who has joined the channel as channel members have access to.
Why is the pen not working? Because I have to... Okay.
So we are wrapping up, but there's like one last point that I want to bring up, and that is the ending part of this legislation talks about working on identifying the most likely new diseases to emerge for future pandemics and pandemic preparedness, which is something that the Obama administration started to do and the Trump administration fucked up.
Right. But this is really hard to do. This is really hard to do because, you know, we can trace flus, we can trace coronaviruses. But it's really hard to keep tabs on every animal in every world, everywhere. We still don't know what the origin species for COVID-19 was. We still don't know. We don't know if there was an origin species that had a direct contact with a human being. We don't know if there was an intermediary host. We don't know.
Currently, the theory is bats and pangolins together. From back to pangolin to human.
Yeah, but pangolin's kind of sketchy.
Well,
They're
no,
not
they
real
said that
100% on
there's
pangolins.
they said that there is a particular structure that would have worked with pangolin lungs, and a pangolin receptor.
Okay, but it's
the ACE2 receptor in pangolins is apparently very similar to
but
ours.
it's hard.
Thank you so much, Carpathia.
Thank you, Carpathia. But it's and thank you, Akeda.
It is apparently warm in Mammary Land.
Oh yeah, I mean the mammaries are closed. It's cold, yeah. But the mammaries are closed tonight. But you know, it's hard to track down every species of every thing that can cross over to us. So it's the best we can do is watch for new emerging things. Just like if China had been more forthcoming with their pneumonia cases. And I say this
let's not even talk about forthcoming. Like, they actively suppressed it, and the doctor who discovered it died.
I remember about November, December of 2 years ago, because fuck, it's 2 years ago now. I was reading a Reddit thread, and somebody was like, you know, with the new year coming up, what's a story that you think we should all be watching for? What do you think is going to be something that may peak in 2021? And somebody actually said that there are these high strains of pneumonia happening in China, and they think that that's like, you guys are going to hear about it in a few months, and that was COVID. So what we can do is we really do need to work with other nations, and we really need to work on our international relations to have other governments feel that they can trust us, so that when something like this does happen, we can immediately get on it, immediately get a pandemic team on it, and study how these are spreading before it gets to this point. A large part of it came from China didn't want to work with Trump. They didn't trust Trump. He put huge tariffs on them. They didn't trust that their information would be taken seriously. They didn't trust that their information wouldn't be manipulated. So they didn't give it to him. We also have to work with governments that are hugely secretive, and this punish the child thing isn't working. When you make everything extremely strict, the only thing you're going to teach your child to do is hide shit. We need to be open to the point that these highly paranoid governments feel that they can trust us. So that when there is information like this, they feel they can. Because Korea knew about it. North Korea knew about it. Russia, they found, were taking actions and plans for COVID as early as December of last year. Russia knew about it. What does North Korea and Russia have in common? These are the two nations that work the most closely with China at this point. They were making preparations for this.
They're also highly top-down authoritarian regimes.
Oh, yeah.
That's the other thing they have in common.
Yeah,
but
we need to find a way to have highly paranoid governments trust us. And we blew that a lot with Trump. We really did.
I mean, Trump actually ceded a lot of European power to China and Russia.
Mm-hmm. Yeah.
But yeah, Midnight
thank
Mist,
you, Midnight.
December of 2019.
Because we've been doing this as long now.
So I guess kind of to wrap up on my side, I'm excited to see Biden working on this. I'm not so happy about seeing the let's reopen all the everything safely while all this stuff is going on, because
Same.
A lot of health experts that I've read, and maybe this is something that I'm out of date on by a month or two, have stated that we need another lockdown for 2 to 3 months in order to have a bat's chance in hell while doing the vaccinations of maybe putting a curtail on things, which I completely agree with, because again, like, let's talk about this for a second. For those who are like, well, let's reopen everything and, you know, slowly people are going to get vaccinated and the people who are at risk can just stay home. Even if I stay home, which I do most of the time, I leave my house twice a week.
I don't even leave the house that often.
Yeah, I leave my house twice a week. Once for a critical healthcare appointment that I have to go to every week. Yeah. And the other one is every so often I have to leave my house maybe to get supplies for certain things, like for commissions and stuff. Because when it comes to shopping for yarn, just buying stuff online is not always the best idea unless you know the brand. And even then, you can't guarantee your colorways are going to match. There's a whole ass thing about that. But those two things are the only reason that I ever leave my house. Is one of them is to pay for commission supplies, and the other one is for a critical healthcare thing. I didn't leave my house hardly at all when I got sick because my husband brought it home from work. Me not leaving my house did not stop him from getting sick because other people were being dumb. And the thing is, even if we all stay home,
my kid brought it home from school.
Even if we all stay home, though, that's not going to keep all the people who are swapping spit and, you know, like putting their freaking mucus on each other's hands with handshakes and hugging each other and shit. That's not going to stop them from passing it back and forth because we now have proof that people can get it twice. Yeah. And coronaviruses in general, you only get antibodies for them for about 3 months.
My kid got it from school. He got it. It was funny how that happened. It was, he got really sick. And I brought him to the doctor and I'm like, he can't go to school. And he's like, oh, it's a cold, because they didn't realize at that time that pink eye was a symptom of COVID. Oh, that's how we know it's not COVID. He's not running a fever. He's got pink eye. He can go back to school in 3 days. And he couldn't breathe. He was coughing like crazy. And I called the doctor back on day 2. And I'm like, y'all got to extend. No, it was day 3. I was like, y'all got to extend this note. And he was like, all right, I'll extend it through the rest of the week. The day after I called for that note, everything shut down. The day after. He got it from school. And if you think a bunch of kids ain't gonna lick their fucking hands and scream Corona and fucking chase each other, then y'all don't know fucking kids. If you think Timmy's got a fucking Iron Man mask on and fucking Johnny's got a fucking Batman mask on and they're like, oh, let's switch. If you think that shit is not gonna happen, y'all don't know kids.
Well, not only that, let me finish my thought for a sec, because this is a whole thing. You saw me pop the fuck off on Twitter. You've heard this rant. You know what I'm about to go out. For people that are like, hey, let's do the community spread thing. Let's get natural immunity, whatever the fuck. You know, the people who are going to die, they can stay home. You know, even if we got financial assistance for us to stay home, y'all are going to keep fucking swapping spit and mucus. People can get it twice. You only get antibodies for about 3 months. And that means, guess what? There are long-term effects, even if you don't get severe symptoms. They're finding that even people who are asymptomatic can still get raised risks for things like stroke and clot and damage to various body systems where the ACE2 receptor is essential, which is most of the cells in your body, by the way. People are getting nerve damage from this shit, and that's the first time. The second time carries a much higher risk of intubation from the limited data that we have. So basically, what we're being asked to do at that point is roll the dice over and over and over, because if it didn't kill you the fucking first time, let's keep doing it until you all are dead. It's almost eugenics to argue that.
Real quick, Chew, you can go on to the Moderna website, the Pfizer website, oh my God, Pfizer, no, I'm sounding German. The Pfizer website, the Johnson & Johnson website, they'll have a whole list of what's in their vaccine. That's part of a vaccine mandate in the United States, is that every vaccine has to have an entire fucking list of every fucking ingredient in it. Birdie Strange, I'm a little confused by your comment. I understand that's needed, but unless there is some significant financial assistance, I'm against it.
Oh, we're talking about the everybody stay home thing.
Yeah, but I'm trying to clarify this. My partner is almost a chef, and we will go insane if he doesn't get it. I'm not quite sure what you mean.
Financial assistance. That's a following for if we don't basically, if there isn't enough money to make sure you can pay your bills while you're stuck at home and immunocompromised.
Yeah, I'm for that. I think there should now. I have a weird fucking plan now. We need to freeze mortgage payments. We need to freeze rent payments. Absolutely. We need to freeze utility payments.
I would add property taxes during that period.
Yeah, of time property taxes, same thing.
Unless you're a landlord and receiving income off the building, that would be the only exception. But if you're in just like a house, then
I'm rolling property tax in with a mortgage, because it usually is rolled in with that.
But well, the thing is though, unless you're a landlord, on their property taxes are a thing you have to deal with.
But I think instead of pushing these pork bills through where we're sending money to Pakistan, we're sending money to Israel, we're sending money here, we're sending money there, we're dumping money into the fucking Lockheed Martin to make fucking planes. We need a robust COVID bill that has a bailout for landlords, that has a bailout for states who are missing out on the property tax, that has a bailout.
But this.
Right. That has funds set aside to keep utility infrastructure going. This is where our money needs to be going to. Our money doesn't need to be going to, and I hate to say this because I do think that gender studies is important, but I think right now when we're dealing with COVID and we're dealing with a country dying, we need to put that on the back burner. And instead of sending money for gender studies in other countries, we need to have comprehensive financing and a comprehensive plan to properly shut down the country. We can't shut down the country. We are way too encased in a capitalist society to shut down the country without financial assistance. We need universal basic income. We need rent, property tax, and mortgage freeze. And in order to combat that, we need a relief package for landlords. We need to freeze payments on utilities. And on the back end of that, to keep these companies going, we need a set amount of money aside to pay TVA, to pay whoever the fuck is providing electricity. Another controversial take that I have is we need to stop giving people the incentives to fucking travel. It is not the airline industry's fault.
Pika, I actually covered that I'm going to be doing a collab specifically about that with Nervardia pretty soon, and we're going to have Meryl on, who will probably mention it next week when we have her on.
I believe that we need to stop giving people the incentive to travel. Shut the fucking airlines down. Give them a fucking bailout. Because it's not their fault that this shit happens. And I understand that you have a whole fucking industry of pilots and stewardesses and cleaners and food workers that are employed by the airline industry. Give them a fucking bailout. Shut down fucking Amtrak. Give them a fucking bailout. Shut down fucking Greyhound. Give them a fucking bailout. Stop encouraging people to fucking travel. Stop giving them the means to do this shit. Give these corporations, give these sectors the fucking money that is going to fucking Lockheed Martin, that's going to fucking Boeing to make planes, that's going to fucking Smith & Wesson to make fucking 9 mils for the military. Take this pork money bullshit out and start giving it to people, to utilities, to states, to landlords, so that everyone has the means to sit the fuck down and shelter in place. What would happen if there was a fucking massive natural disaster? What happened if fucking
this is a natural caldera? This is a massive.
No, but I'm saying what happened if the Yellowstone caldera fucking blew?
Right, we'd all be dead already.
Well, a large part of the country would be dead, but
I would be dead.
You would be dead. But we're dealing with the same kind of logic.
You would be on your own channel probably crying that one of your friends is dead.
No, I'd be totally pissed at how the government handled it, and I'd be fucking screaming. But what would happen then? If it happened, boom, like that overnight? And you suddenly have half the country that can't walk outside because it's raining ash outside. What would they do then? We need to start looking at pandemics. We need to start looking at slow developing natural disasters in a way that we need to be prepared for them. We need to start we need funds that if shit like this does happen and people have to stay home to be fucking safe, that we have the funds to bail out the airline industry, to bail out, banks missing a fucking mortgage payment, to bail out fucking landlords, to bail out utilities so that people aren't sitting there starving and freezing. What we have a problem with is money allocation in this country. We have the means to pay people.
Jack and Quill, I'm in Washington. We'd be dead too.
Yeah. They just don't have we have the money. We have the fucking money. The fucking taxes we're paying and the fucking tariffs that we're paying and the tariffs that people are paying us, we have the money. It's the allocation of where that money is going is the problem. Midnight, I agree with that. I believe that universal healthcare should also cover virtual. A lot of healthcare providers do not cover virtual appointments, and I am a strong supporter that it should cover virtual.
Jack and Quill, if you want to try to safely socially distance and meet up, and you'll be in the Seattle area, shoot me a DM. That said,
nobody cares to come by me because it sucks.
That said, we are in the wrap-up portion. Miss, I want to wrap up later, and then goes off on a ramble. We're in the wrap-up portion. My job is to yank on the leash every so often. What do you got going on this week?
I'm going to sit.
Apart from shaking papers annoyedly in my face for doing.
I'm looking like the guy in the disaster movies that nobody pays attention to but knows everything, just shuffling.
Maybe if I move them enough, you'll notice me.
Maybe if I move them enough, you'll listen. I am Jeff Goldblum. Next I'm going to be doing a video on the abject failure of Texas and the southern states when it came to this weather. Abject failure. And it's going to be angry and it's going to be ranty and it's going to be yelling. I don't know if that's coming out tomorrow.
Jen said that she's going to be recording afterwards.
Yeah, it might come out tomorrow. I may stop and take a break and then be like, holy shit, I have to go to bed. So I'd be like, okay, fuck it, it's coming out Saturday.
So, for what I'm doing this week, which, by the way, all of you guys that currently are have signed up to become channel members, the post for this week's video is up, and you guys have access to the preview. I also made it available for my patrons over on Patreon. This week, I did a video on divine experience and how to discern what a divine experience is, what divine experiences look like in antiquity, debunking some common myths about divine experiences, such as symbolism has to pertain to what ancient peoples knew existed in the world in dreams and stuff. And I talked a little bit also about the ever-present debate around mental illness, and gave my take on mental illness and divine experiences and ableism and stigma. So for those of you who are curious, it's a 15-minute video. It's the beginning of a series on this particular topic because it breaches everything from divination, which is divine contact, to a concept called Tarsain, which is kind of divine certainty, like the God sending you a message that they have your back. It breaches into concepts of like omen reading and things like that. And each of these things is going to need its own video. But this is kind of an introduction. It's called So You Had a Divine Experience. And it's kind of like, it's kind of about that and feeling crazy. And hopefully by the end, for those of you that are grappling with whether or not you have one, you'll feel a little less alone. I share a little bit of my UPG. Jen has heard both of the stories. I share the Athena story briefly.
Are you going to use one of my... We all know Jen's a pagan, but she refuses to believe it. Stories.
The other one is actually the $200 book story. I tell that story. I don't reveal who the person who gave me the money was, but I talk about that, which Jen can vouch in this live chat. I told her the day it happened. I am not making this up. The day it happened. Yeah, I told Jen the day that this, because I told Jen before I did the ritual, that was the commitment to the oath that I was going to do that ritual. So she has this as a record, and then later I told her about the gift and the book and everything that happened right afterwards. So she knows this story is true because she heard about both sides of it when it happened.
Wish list. I was like, I need a fucking wish list.
But Jen was even like, I'm having a very hard time saying that that's a coincidence, but I'm gonna have to because I'm an atheist.
I mean, I feel like I'm obligated to say this.
But if by fun, Andrew, you mean extremely stressful, very delicate, and very hard to cover, then yes, it was very fun.
Absolutely fun. Actually, considering how I'm feeling now and the fact that I really have to pee, I probably will get that video out Saturday because I'm...
Blair, I actually talk about that too.
For those of you who are not content creators, being in front of a camera is funny because it's like... Being in front of a camera is really funny because it's like you're going, and then out of nowhere you hit this wall where it's like, I can't do this anymore. I need to stop. That's exactly what happens with content creators, like especially when you're
camera fatigue.
Yeah, and it's like it never comes on slowly. It just punches you in the fucking face, and it's like, yep.
It's like suddenly you're tired. I have had that happen in my solo lives more often than because you've got the person to play off if you're working with somebody, but if you're by yourself, like you hit a wall and you're just like.
See, it's the opposite for me. It hits me when I'm doing, like, my solo streams are great. I can do those all fucking night. But bouncing off of somebody else, I feel like somebody fucking smacked my face into a brick wall at some point. It's like, okay, done.
So, for next week, big thing, we announced it earlier, but Nervardi is going to be coming on next Wednesday at our usual time because we officially have moved the show to Wednesdays because Jen has obligations. Yep,
Like,
Jen has
geez.
obligations with kids, and I have partners who have new days off. So, because of the fact that my date day shifted from Wednesday to Monday with one of my partners, I now need to move Wednesday, move date day so that I'm not cutting into date day because, my partners each have a whole day that, like, they can do whatever they want with me.
Yeah.
We hang out, we go on dates, we do stuff. So, like, currently going on dates consists of renting some kind of movie and maybe ordering takeout. But we used to do actual dates back when the world was not burning.
In the before times.
In the before times. But Nervardi is going to be coming on to talk about vaccine safety, the COVID vaccine, what we do and do not know about it. And we're going to be talking a little bit about the mishandling of the pandemic by the American government, by the previous administration, getting into a little more detail about the differences in the way that the administrations in Nervardia's country handled it in Australia versus here, and why there's a difference in outcomes because of it.
And I think on that I'm going to... Because it was really interesting. It was, Australia and New Zealand were like fucking on it, right? They were like, oh shit, we got sick people, fuck it, get it handled. They did. And then I think it was Sweden who was like, oh, we're going to try this herd immunity thing. And it kind of worked for like 2 months. And the US was like, now this is when the fucking states want to follow the Scandinavians, right? Like now they're like, oh no, this is like totally what we should be doing. Fuck every other aspect that they have that we should be following. But this herd immunity shit, yes, we're going to follow this. And how that totally backfired. And then here's the US that's like, oh, so Sweden fucked this up? Hold my fucking IPA.
It has to be an IPA.
I mean, come on.
All right.
I'm sorry. Ruidhan. Am I saying that right?
Ruidhan.
Ruidhan is right. Cyrus will admit he's a pagan before I do because I am too stubborn. I'm like, no. Like, one of the gods could come down and talk to me, and I would literally be like, can I help you? Why? What do you want?
As you guys can see in the live chat, Mero has some opinions about this, so there's a reason we're having her on to express them, because I've been hearing about them for a while. Ruan. Thank you.
But yeah, like... No, like one of the gods could come and talk to me, and I'd be like,
Jack
I'm not here for that.
The meme
Why are you
artist just
bothering
canceled
me?
you because you drink IPAs.
I don't drink IPAs. I think they're fucking disgusting.
Jen was mocking people who drink IPAs.
I dated somebody who was like this total fucking beer snob, and I swear to fucking God.
He will admit he's pagan.
I am not admitting. I'm saying if one of the gods ever decided to come down and talk to me, I would probably blow them off.
Clip that, put it out of context, tag Jen, and make $1 million.
I would probably blow them off like I do to random DMs and be like, "What? Why are you here? What are you trying to say to me? I'm not interested." Bye.
You heard it here, folks. Jen would probably blow them. Anyway,
I mean, if I was guaranteed not to get COVID.
All right, guys. So with that, now that we have gone all the way to Memory Land and back and taken a detour into the world of testes, thank you guys so much for hanging out with us. I know this one was a little long and rambly, and the gremlins were definitely here with us tonight.
And like nothing was working.
For no reason. We managed to get through a pretty hefty amount of information despite our predilections to fuck off into every corner. We got through most of that document, which I'm really proud of considering how much of it was fluff and how difficult it was to pick out what was important and what to talk about.
I know.
So thank you guys again so freaking much for hanging out with us. I will say this at the end of every show. We built the coalition. Now let's fight. We're stronger together.